Welcome to our weekly broadcast of the African Treasures. Here we bring to you African arts, culture, and music. We also discuss issues of concern to people of the African descent in America, the Caribbean, South America, Africa, and all over the world. We invite you to come and see Africa in a positive light. So stay tuned and tell your friends to do the same.
Welcome to another episode of African Treasures. I'm Dr. Michael Okeke, your host. Our focus today is on HIV/AIDS, and our guest is Joyce Drayton, MD. She's the medical director of the Atlanta Infectious Disease Consultants, and also a specialist in infectious diseases. Welcome to the show.
I'm happy to be here.
Dr. Drayton, what is HIV?
HIV is human immunodeficiency virus, and it is the cause of AIDS, which is acquired immunodeficiency syndrome.
Where did HIV come from?
Well,
I know that's a controversial topic, but I got to ask you that. Where did it come from?
The most widely accepted theory is that it was transmitted from green monkeys and actually from a subgroup of chimpanzees to humans through the practice of hunting the animals, skinning them in the field, and being exposed to the blood of the animal.
But they don't hunt chimpanzees and monkeys in San Francisco.
Well, no, but
so what is that suggesting?
But the disease is transmitted in a number of ways.
Right.
And so since the world is so small and people are traveling, it's not difficult for there to be an isolated incident of disease that turns into a pandemic, as we're seeing with AIDS.
Okay, that was a very nice answer. Okay, what is AIDS?
AIDS is acquired immunodeficiency syndrome, and it's different from HIV infection. A person can be infected with HIV but not have the syndrome of symptoms that are associated with AIDS. AIDS occurs and is diagnosed when a person loses a certain number of their lymphocytes that fight infection and fight cancers. Those cells are called CD4 cells, and when the CD4 count drops below 200, we say the person has AIDS. Or if the person develops a disease that is what we call an AIDS-defining illness, then we would give them the diagnosis of having AIDS as well as HIV infection.
I'm assuming that HIV causes AIDS, and if that premise is true, then I'll ask you, how does HIV cause AIDS?
HIV has an affinity and infects.
Or does it rise to the level of AIDS? Is that it graduates into AIDS? Is that what it is?
Well, HIV, the virus itself, infects a type of lymphocyte or white blood cell that fights infection. In fact, it's unique in that it infects the very cell that would kill viruses. And so over a number of years, a person will slowly have a decline in the number of those cells. But it takes a long time. A person who's infected with HIV, about 50% of those people will progress to AIDS in about 10 years, because your body has a lot of reserve and your bone marrow produces millions of these cells per day. But over time, the number of viral particles in your body that are infecting these cells overwhelm your immune system.
What about the other 50%?
Well, there's a bell-shaped curve. Okay. So there's some who'll develop before 10 years, and then others who'll, it'll take 12, 15, 20 years.
But whether you have AIDS or HIV, they are still infectious. Or can HIV be infectious, or is this just AIDS that's infectious?
AIDS is a syndrome. AIDS is a constellation of symptoms. Okay. The infectious agent is HIV. Okay. And yes, HIV is infectious.
Now, who is mostly at risk?
High-risk groups include men who have sex with men, IV drug users, particularly those who share needles, and infants born to women who are infected with HIV. They can acquire the virus transplacentally when the mother's pregnant. They can get the virus during delivery, and a large percentage get it during nursing. It can be transmitted after birth.
Do you have figures as percentages in Georgia, women and people of color?
Mm-hmm. Yes, well, the epidemic has changed and is changing. We're seeing more Southerners being infected, more women being infected, and people of color making up a greater percentage of those with HIV and AIDS. In the state of Georgia, there have been cumulatively over 26,000 people who've developed AIDS.
And that's both Caucasian, women,
that's
men,
everybody.
Over
26,000. 75% of people of newly diagnosed cases in 2003 were among African Americans.
Wow.
25%
of that number.
Right. So, well, about 13% are cumulatively have occurred in women, and of new infections about 25%. So the percentage of women who are making up people with AIDS is growing.
Oh, scary. Mm-hmm. Well, we have a lot. I have some other questions to ask you, but we're going to pause for a station break. Mm-hmm. And please don't go away. We'll be right back.
Of dawn, she's roaming city streets, she's combing, searching high and low for a solution. But I see her, oh Lord, she's headed for corruption, yeah. So I say, get it off, shake it off. Gotta get the monkey off your back. I say, oh black woman, stand and walk with pride. Get it off, shake it off. Gotta get the monkey off your back. I say, black woman, get up. Oh, it's time to stand and walk with pride, yeah. Poor black sisters been pushed and shoved, hit rock bottom, chasing some lost love, looking for the answer from up above. Oh Lord, they got us sitting, hairstyle children is begging bread, and so all I've got to say is get it off, shake it off. I gotta get the monkey off your back. I say, oh black woman, stand and walk with pride. Get it off, shake it off. You gotta get the monkey off your back, no more folly around. Sell yourself short all around town, yeah. In the streets with weeping eyes, 'cause you done caused destruction of your family ties. Wishing, oh, you're praying, yeah, you could erase the sin. Now you're a pawn in the battle. I say you're losing the war within. So I say get it off, shake it off. Gotta get the monkey off your back. I say, oh black woman, stand and walk with pride. Get it off, shake it off. Gotta Yeah, get the monkey off your back, no more folly around. See yourself short all around town, yeah. They got you bartering with your earthly possessions, yeah. For a TDP.
Welcome again to African Treasures. Our focus today is on HIV/AIDS, and our guest is Joyce Drayton, MD. Welcome again. We were talking about numbers before we went on break, but I'm going to ask you this. How can one tell if he or she is infected with HIV?
It's hard to tell, and you may not know, because many people with HIV infection have no symptoms. Some people will have notice purple or purplish lesions on their skin. They may have whitish plaques on their mouth or tongue. They may undergo weight loss and have extreme fatigue. Recurrent pneumonia might be a sign of it. Having something called shingles. You might have had a grandparent who had shingles, which is a vesicular viral rash that shows up on half your body. Anyone who's had any sexually transmitted diseases is probably at risk. But many people are asymptomatic. In fact, most are asymptomatic. So the only way to really know is to be tested.
Before I go to how or where we get tested, let me ask you this. Is it possible to... I've heard that people who have sexual transmitted diseases are at high risk, because if you could get that, then you probably must have gotten infected somehow. Is there a correlation there?
Sure. Of course, anyone who's had a sexually transmitted disease is likely not to have been practicing safer sex using a latex condom. And so they, of course, would be at higher risk of having acquired not only that sexually transmitted disease, but HIV. Interestingly, the presence of a sexually transmitted disease, syphilis, gonorrhea, herpes, or any of the others, really, increases the likelihood that a person will transmit or contract HIV during one sexual encounter because of the inflammation in the genital tract. There's also evidence that co-infection with syphilis, if you have HIV, facilitates the virus entering cells and spreading itself. So there's definitely some relationship between sexually transmitted diseases, other sexually transmitted diseases, and HIV.
So it's a red flag.
Absolutely.
Where can one get tested for HIV?
There are a number of places to be tested: health departments, private physician offices. We offer testing in my office, and there are a number of community-based organizations that have funding to offer HIV testing at a reduced rate or even free.
A lot of people would like to be tested, but they are scared of being quarantined, kind of. So what do you say to that?
Well, there's no quarantining for HIV.
If it's made public, how much privacy can one have?
A great deal. There's quite a bit of legislation protecting one's any medical information. And the law requires that you have pre-test counseling, that you sign consent, and that it's explained to you that this is absolutely confidential. I cannot tell a person's boyfriend, even if I know them, that they have it if that person is my patient and I know that. So it's... But
a lot of people kind of assume that when you go for regular blood tests, that's automatically done.
Oh no, that is something that you can request. Many physicians will offer to you, and you will know that you've had it because we do have to go through this legal process of doing pre-test counseling, signing a consent, having it witnessed. So it's not a routine blood test.
Because I know when you go to hospital and complain about of something, usually they draw your blood to find out what's going on in your body. Right. If you go for prostate exam, they draw your blood. If you go for one problem or the other, all routine physical, they draw your exam. They draw your blood.
Sure.
Do they test for AIDS or HIV when they get your blood like that?
If you, in the state of Georgia, if you've been if any blood has been drawn and you have not been specifically told we are getting an HIV test and gone through this pre-test counseling and signed a consent, no, your blood has not been tested.
I would assume that that's part of total physical.
It is encouraged that you offer it. And I'll mention, I do offer it to patients. Now, not all people agree to it, but it is not a routine test.
It's not a routine test.
Because the law dictates that we do all of these things before we draw the blood.
So somebody can come through your office or any office and go through a routine physical, they draw his blood or her blood, and he walks around with HIV and don't even know they has because it was not tested.
Right. That can happen. But of course, we're very vigilant. Clinicians are vigilant for that. And if you're having a complete physical, we're getting a complete history. We're assessing your risk for that. And we're offering it to patients. Particularly if you're in the hospital, patients should be routinely offered that as an option. There are patients that I encounter who I think should definitely have a test, but if they refuse to sign the consent form,
so if you don't sign a consent form, even if you get total physical, you can't walk away thinking, oh yeah, they tested everything.
Right.
You cannot do that.
You can't assume that.
That may not be good protection for doctors and people in the health profession. They need to know because, well, they're at risk too.
Yes, there is occupational risk. HIV is not particularly infectious. It dies very easily. If it was on the table in some blood, as soon as the blood is dried, it's gone.
Oxygen?
In fact, hepatitis B is about 300 times more infectious from a single needle stick than HIV. So there is occupational risk. The risk is low. But it's important, sure, for healthcare providers, but it's important for everybody to know their status. And there's so many places that do offer testing and anonymous testing, if that's a concern. Those places can be found through different websites, the CDC, your health department, and everyone should know their status and be tested.
I think it's important because otherwise somebody can go on infecting other people without knowing. Especially, and health professionals are exposed and they're more at risk. So I think I'm not trying to propose legislation here. But this is very interesting. We're here with Dr. Joyce Drayton and talking about HIV/AIDS. We shall be back.
We all know that dialysis can be an uncomfortable and tedious process. We at Trinity Dialysis Clinic understand this and strive to make your visit as positive and comfortable as possible. Our experienced staff and state-of-the-art medical equipment will ensure that you will get the best quality treatment available. Trinity Dialysis Clinic is conveniently located at 1354 Cleveland Avenue in East Point, just 5 minutes from the airport. Come and enjoy a relaxed and uplifting environment with us and make Trinity Dialysis Clinic your home away from home.
Welcome to Trusty Drugs and Home Healthcare, where we provide you with a wide variety of products and services. Visit us for all your prescriptions, compounding, over-the-counter drugs, children's services, and much more, as well as state-of-the-art, durable medical equipment. Our dedicated staff and registered pharmacists are waiting to give you a friendly and professional service. We are located at 435 Forest Parkway in Forest Park, Georgia. You may call us at 404-366-9088. Trusty Drugs and Home Healthcare is the name to remember.
Welcome again to African Treasures and to this wonderful and useful topic, HIV/AIDS. If you missed this discussion or if you want to watch it again, please remember to log on to our website. It's www.africantreasurestv.com. Get on our website and watch any of the shows that we've done in the past 2 years, more than 35 of them now. So welcome again. And we have a very short time left, and this is very vital information. And I want to ask you this: what about pregnant women? Pregnant women and AIDS or HIV?
Well, the recommendation is that every pregnant woman be tested for HIV infection.
But are they really?
Oh, yes, it's pretty universally done by obstetricians in this country.
Okay.
And, of course, for those women who seek prenatal care, you have to be in the system. And that recommendation is made because treatment can drastically reduce the risk of transmission of the virus from the mother to the fetus or to the baby. Mm-hmm. Mm-hmm. The rate without any intervention, if a woman is HIV positive in this country, is about a 25% chance of transmitting the virus to the baby. And that can be reduced to below 8% if the diagnosis is made early and if treatment is started during the pregnancy.
Yeah. There's something that, speculation out there that I want to bring to your attention. Is it possible that somebody might test HIV positive and have a spouse, and the spouse is not?
Yes, these are what we call discordant couples. One couple is HIV infected, the other is not. And there are studies looking at the transmission rates between couples, and this gives us some of the evidence that consistent use of a latex condom is an excellent way to reduce the risk of transmission.
But they don't know. Mm-hmm. They didn't know.
Well, most couples who are discordant are the person that is HIV negative is tested regularly every 6 months. Okay. They're followed by physicians. They're counseled every time they come in about to keep them using condoms regularly. Mm-hmm. And people have remained HIV negative for many years.
Does it mean that they're HIV positive, but they can be infectious? Is that why the spouse never got it?
Well, the use...
Because that's really, I mean, we know of a popular case. I don't want to go mentioning names here.
Mm-hmm. Well, the use of the condom reduces that greatly. And then if the person who has HIV is on treatment to suppress the replication of the virus, their risk of transmitting it is decreased too. So there are quite a few interventions that are done to reduce the risk of transmission from the one partner to the other.
Well, let me run down this list real quick. Mm-hmm. Can somebody get AIDS by bite of mosquitoes?
No.
You can't?
No.
Can you get AIDS by shaking hands?
No.
Can you get AIDS by hugging somebody?
No, no.
Can you get AIDS by showing love and affection by hugging? All this kind of stuff.
By hugging, no. Casual contact is not. HIV is not transmitted through casual and household contact.
I'm asking this. I mean, I know that. It's just that I want to make sure that our viewers get to have those things answered by a specialist. Mm-hmm. And what about kissing? Mm-hmm. You can get,
kissing is, kissing is what we call a low-risk transmission. There is HIV in saliva. There is perhaps a case in which HIV might have been transmitted by kissing, but the people had sores in their mouth and a lot of blood, and you really have to. So
if there's no laceration mm-hmm. In the body. Mm-hmm. where body fluid can be transmitted, can be exchanged.
Mm-hmm. Well, I wouldn't say laceration. It is transmitted across mucosal surfaces, and there's mucus and mucosal surface in the mouth. Deep French kissing may expose the person to some HIV in saliva, and that's why we don't call it a no-risk activity. But I can only think of one, publication in which it was transmitted that way, and again, those people had dental issues and really, a lot
because a lot of people bleed when they brush their teeth. Mm-hmm. A lot of people have periodontal problems,
right? And
that's what I was referring to. Mm-hmm. Maybe laceration is a more extreme term or the wrong terminology for that. But with those type of exposures in the mouth, one is at risk. Because I was thinking maybe it allows the blood to come out and maybe get
Well,
to that
remember,
person?
HIV can be found in tears, but it doesn't mean that because it's found in that fluid, it can be transmitted that way. And so, again, with discordant couples, there are things that you do. If I reduce your viral load, the number of copies of virus that I see in the blood, it reduces that risk. And that's why it's important for everyone to be tested and to know their status so they can get into care if they are HIV positive and do those things to keep themselves from getting HIV if they're HIV negative.
Dr. Drayton, I'm very thankful for your coming here. And like I told you before we started this show, a lot of people want to call in and ask you questions. So we're going to have to bring you back and have a phone line when people can call and ask you questions so you can respond to that.
I would be happy.
But I want to thank you very much and for educating us and for enlightening us a little bit. And thank you for allowing us to come into your home with this wonderful information. And stay tuned, okay? Keep on watching. And thank you.
Blessed is the man that walketh not in the ways of the ungodly, nor shall he stand in the ways of sin, nor sitteth in the seat of the scornful man. But his delight is in the laws of Jah, and in those laws he meditates day and night. Well, he should be like a tree planted by the rivers of water so deep. Everything that he does shall prosper, that's the way Jah wants it to be. I say, he should be like a tree planted by the rivers of water so deep. Everything that he does shall prosper, that's the way Jah wants it to be. I say, blessed is that man that walketh not in the ways of the ungodly, nor shall he stand in the ways of sin, nor sitteth in the seat of the scornful, Jah sees us all. The ways of the righteous shall prosper, not fall. The ways of the ungodly shall perish away. I say, Jah sees us all. The ways of the righteous shall prosper, not fall. The ways of the ungodly shall perish.
Thank you for watching, and please join us again next week at the same time as we continue to share with you the treasures of Africa.